We're interested in developing hematopoietic stem cells or blood stem cells outside the body for treatment or use in bone marrow transplantation. Bone marrow transplantation right now is used for treatment of blood cancers as well as immunodeficiency diseases that require new bone marrow or reconstitution of the hematopoietic or blood system in those patients. One of the major obstacles to bone marrow transplantation is finding a matched donor. So the blood actually has to match your not necessarily blood type, but these HLA antigens. So certain antigens, the more antigens you have related to your donor, the better engraftment you have of the bone marrow transplantation. Finding that perfect sort of match is very difficult. So a lot of times people are transplanted with either mismatched blood, and also cord blood has been a source for hematopoietic stem cell transplantation. However, when you're transplanted with mismatched blood or minimally related blood as well and or cord blood, you actually have a higher chance of rejecting that transplantation. So one of the goals that I hope to achieve with the Innovator program is to understand how we can grow larger numbers of blood stem cells outside the body, providing for higher numbers and larger pools of stem cells that would be sort of off-the-shelf ready for bone marrow transplantation. The initial site of blood stem cell formation is actually from the blood vessel walls. So blood vessels actually produce the initial blood stem cells when you're an embryo. So what we're interested in understanding is how is it that the blood vessel wall produces the first blood stem cell, and can we then take, instead of taking blood from the bone marrow, can we take blood vessels from, say, an umbilical cord or a piece of skin? Can you grow those blood vessels and actually coax them into producing blood stem cells again, like they once did early in development? And ideally, we could bank blood vessels, which are much easier to grow and expand, and then coax them into making blood outside. So almost sort of little blood factories in a dish.